Hello, in this lecture we will start our study of chapter 25 by studying fluids. Now a lot of this lecture will be review for you, and we're going to start by just talking about what is the human body made out of. Well, if you look at the body, it's actually mostly water. We do have a lot of protein. Proteins has many important functions. Fat, and then you can see that there's different minerals, there's some carbs, usually stored in the form of glycogen, and miscellaneous. And if we look at the body fluids are separated as a intracellular fluid. So intracellular fluid, or we say ICF, this is the fluid found inside of cells. And then you have extracellular fluid, which is the fluid found outside of cells. And we'll be looking at that shortly. And again, if we look at the solid components, the most abundant organic molecule in our body is protein, followed by the lipids, the minerals, the carbs, and then we just have this whole miscellaneous with some of your micronutrients. How much water do we have in the body? Well, it's roughly 50 to 60% of your body weight is water. It is affected by your gender and your age. We know that skeletal muscle has a lot more water than adipose tissue. So typically males are going to have more water than females because they have higher lean body mass. They typically have more skeletal muscle. We also know that as we age, we do lose water in our bodies. And if we look at the total amount of water, it obviously determined by what we take in and what we lose, but look at the different tissues in the body. Notice that again, skeletal muscle is mostly water. So if you're getting muscle cramps, you need to make sure you're hydrated when you exercise. The brain is a lot of water. In fact, it makes up many of our body tissues. So it's critical for life. You could only go maybe 2 to 3 days without water before death would occur, and that would depend on the environmental conditions. But if we look at it, we do have a lot of it in our extracellular fluid. We know that it's a critical component of both fluid compartments in the body, that every operation needs water. If we look at dehydration synthesis or hydrolysis, you need water. Water's either left or added. We know it's critical as a diffusion medium and a transport medium. We know it's critical for, preventing membranes from drying out. So water has many essential functions in the body, which is why it's critical for our survival. So back to the fluid compartments, we mentioned the ICF is inside the cell. This is called the cytosol, and the ECF is outside of the cell. The two main compartments, the two main ECF compartments are the plasma and the interstitial fluid. So when we look at cells, we know that between the cells, this light blue is the interstitial fluid. And then we have our capillary or blood vessel, which will have our plasma. So the plasma and the interstitial are going to be our extracellular fluid, and then the intracellular is inside the cell. And we actually typically have more fluid inside of our cells than outside of our cells. And if we look at this kind of other category, other places we have it that's not inside a cell would be cerebrospinal fluid, synovial fluid, lymph also has fluid, digestive juices has water in it as well. So if we look at the electrolytes now, we have what are called solutes, and the solutes are what dissolve in the water. Solutes can be either electrolytes or non-electrolytes. So what is the difference? Well, a non-electrolyte is usually something like an organic molecule like glucose. If you were to put them in a solution of water, they do not dissociate. They don't split apart. So glucose is C6H12O6. If I put it in water, it stays glucose. Those carbons, hydrogens, and oxygens stay together. But electrolytes dissociate. They split apart. So if I add sodium chloride to water, notice it completely splits apart into ions. Ions are charged particles. So an electrolyte has a charge. And the ions, you can see there's sodium with a positive charge, and there's chloride with a negative charge. So when we add any electrolyte to a solution, to a watery solution, it's going to split apart and increase the solutes. Whereas if you add a non-electrolyte, you end up with the same number. So for example, let's just pretend that I put 6 glucose molecules in water. Well, then I would have 6 glucose molecules in that water. But if I were to add 6 sodium chloride molecules to water, that would actually dissociate into, it would split apart into 6 sodium and 6 chlorides. So now I have 12 particles in that solution instead of 6. So the electrolytes are very, very important in changing what's called the tonicity or the osmolarity of a solution. Remember, the osmolarity is dependent on the amount of solutes that are present. If we look at our electrolytes, we have our ions. Now they are known as cations and anions. So I always remember the T and the cation as a plus sign to remember that's the positive one. We know that they're in different concentrations in different fluids. Now overall, your whole body charge is neutral. It's 0. It needs to be for cells to function. But we know if we look at our extracellular fluid that we have a lot of sodium there, and we have a lot of chloride. So our main cation is sodium, anion, chloride, and even bicarb. If we look inside the cell, we have lots of potassium. We also have a lot of magnesium here. Now the anion are these phosphates and proteins. A lot of proteins have a negative charge to them. When we look at this water, this fluid, understand that water is always circulating throughout your body and it's always moving between the compartments, between the organs. It's not static. So water that's reabsorbed from your GI tract, from your gastric juice, can enter your blood and end up in a cell. We can excrete it. We can use it as we breathe. So water is constantly moving between all these different compartments. And the factor that determines if water moves or not, we're looking at those pressures, that hydrostatic pressure and osmotic pressure. Hydrostatic pressure, remember, is always pushing material out of the capillary or the blood, and osmotic pressure is always the opposite, and it's pulling back in. So they're two opposing pressures. So normally we're in this, everything's isotonic. We're in balance. And isotonic is when the blood or the interstitial fluid has the same osmolarity as the cell. And so if we look at a typical cell, the tonicity is usually 0.9% NaCl. And if our blood is 0.9% NaCl, then we are in osmotic balance. And water still leaves, but whatever water leaves the cell is replaced and everything's fine. Well, we're not always in balance. And so we know that these shifts can happen mainly due to changes in the osmotic concentration, the osmolarity, or the osmotic pressure. So osmolarity is the solute concentration. If we increase the osmolarity, so we have more stuff, then what that does is that causes an increase in osmotic pressure, and that will draw water toward it. So if we have a situation where we have an increase, so if we're looking at our plasma, so we have normal plasma, normal condition when we're in basically equilibrium, isotonic. But what if we were to change the osmotic pressure of the capillary? So let's say that we increase the osmotic pressure, we have more solutes in it, therefore we would say it's hypertonic. So if the cell was 0.9% NaCl, then the blood would be greater than 0.9% NaCl. Well, we know that water always goes to the area that has the higher osmolarity. The osmolarity creates the osmotic pressure. So what will happen is water will leave the cell and it will enter the blood, and it will also enter the interstitial fluid. It has to go wherever there's the hypertonic solution. Now, what if we change it? Let's say we're super hydrated and now we're going to decrease the osmotic pressure of our blood. Now we're going to have a hypotonic blood. So if my cell is 0.9% NaCl, now my blood is less than 0.9% NaCl. So I didn't really change the cell. I changed the blood. I made it more dilute. But because perhaps I drank a lot of water and I made it more dilute, now water will leave the blood and it will enter the cell. Now, red blood cells can shrink or open up, get bigger, kind of like a water balloon, based on the movement of water. And this is very important when we look at cells and we look at where water moves. So we cannot pump water. Water is at the whim of the hypertonic solution. And so when we look at maintaining balance, we have water losses and water gains. So we lose water every day. We urinate it out. We have our GI tract where we're going to have watery secretions. It evaporates when we breathe, and we can leave it through our skin as well. It can evaporate through our skin, or if we're very, very warm and we need to sweat, it can happen that way. So obligatory is obligated to leave. This is water that must leave every day in our urine. We have to excrete waste products in our urine or death would occur. When we look at obligatory, we have sensible and insensible. Sensible is the urine and the feces together. It's called sensible because you sense it. You have an idea of how often you urinate or defecate throughout the day. Insensible is a little harder to actually measure. This happens when we breathe. We evaporate some water vapor from our lungs and we lose water through our skin. It evaporates. If the humidity is very, very low, water evaporates through. This is also what happens when you sweat, and which is a little more, you can sense that a little more if you're sweating a lot. And then I just have other, because just note that if you have a fever, anytime your metabolic rate goes up, you're going to lose more water from your body. And so these are our water losses. Well, water gains is obvious, what we eat and drink, but we also make it from metabolism. The process of ox-phos, when we learned that, formed water. And so we call this metabolic water, and that's formed every single day just from metabolism. So how much water should you have a day? There's a few estimates. One estimate is just take your body weight in pounds, divide by 2, and that's how much water you should have. And this could be something, you can drink it, you can eat it. Certain fruits have a lot of water, and we know that water is critical for all the tissues we looked at. We know it's critical for normal brain function. If you're dehydrated, you might feel tired, you might feel lethargic or confused. Sometimes when we're hungry, we're actually just thirsty, but our brain gets confused. So if you're hungry, maybe drink a glass of water and wait a few minutes, and maybe you were just thirsty and not hungry. The main hormone that controls our water is ADH. ADH comes from the posterior pituitary gland. We looked at this in the urinary system. It's critical for water reabsorption in the DCT, and mainly the collecting duct would be the main place that this one hits. We know that it will open the aquaporins, and which will allow water to leave and go into the blood. So there are osmoreceptors in the hypothalamus, and they're constantly sensing your plasma osmolarity. Because ADH comes from the posterior pituitary gland, you might remember that the posterior pituitary gland is under control of the hypothalamus. In fact, ADH is made in the hypothalamus and is just stored in the posterior pituitary. So the osmoreceptors are monitoring the normal osmolarity of your blood. So normally our blood is 300 milliosmoles. That's the typical osmolarity. And so we know then that ADH is called anti-diuretic hormone. So it's going to be triggered anytime our osmolarity goes up. So if our osmolarity of our blood goes higher than 300, we would say our blood is becoming hypertonic. Then that's the stimulus that's going to release ADH. And then ADH goes to the kidney, it goes to the nephron, and it opens those aquaporins and it pulls water back so that you do not lose it in your urine. It pulls it back and it puts it back in your blood, so it brings it back to 300. Well, it's inhibited anytime it falls to below 300. So once you get more dilute blood, as it falls, that's going to inhibit ADH. Now you don't release it, so you don't open the aquaporins, and all that water is going to leave in your urine, so it brings it back down. We also know that ADH can be inhibited by alcohol. This is one of the reasons why you might urinate more when you drink, especially if you're drinking a watery beer. And so ADH is our principal hormone that's really important in maintaining our urine output and our water balance. So let's look at some disruptions to this. Edema. we've looked at edema already. We know that if you have too much basically interstitial fluid, you have edema. So anything that increases the flow out of the blood or doesn't allow it to be picked back up. So when we're looking at edema, we can think of it a couple ways. So we could say, one, anything that increases capillary permeability, anything that makes your capillaries leaky. When we looked at the inflammatory response, we knew that we had histamine. And histamine's job was to make your blood vessels leaky. And so if you're going to increase permeability, which is going to happen for inflammation, it can happen in allergies, allergic reactions. It happens when we burn our skin. Sometimes different disorders can cause it, but if they become more leaky, you're going to lose more fluid and more stuff, and that'll accumulate in your interstitial fluid. Anything that causes us to decrease our plasma proteins will cause us to decrease our osmotic pressure. And what we look at for the plasma proteins, we look at the kidneys because they should not be lost in the urine. If we're urinating them out, then they're not in our blood. And the other organ we always look at when we're looking at plasma proteins is we're also looking at the liver. Remember, the liver's job is to make the proteins. This could also happen if you're not eating protein. You have to eat all the essential amino acids every day so you can make the appropriate proteins. The other factor is, well, what if our hydrostatic pressure goes up? Hydrostatic is pushing things out. Well, yeah, that definitely can cause you to have some edema. So maybe heart failure where you're having an increase in fluid, so you're having higher pressure in different areas of the body. This could happen anytime your blood pressure goes up with hypertension as well. And then the last one where I have other is lymph obstruction. We talked a little bit about that lymph that's always going to be circulating back to the blood. Remember that you lose about 3.6 liters of fluid every single day. But if you have an obstruction in a lymphatic, then you won't be able to move that fluid back and you're going to have more edema. The opposite with edema is, well, what if we have dehydration? So now what's happening is we're having an increase of osmotic pressure inside our blood. We are either too salty or we don't have enough water. So you're losing water. It's common with any kind of blood loss, hemorrhage. It can happen with burns, vomiting, diarrhea. It could happen from excessive sweating, a high salt intake. All of those can cause dehydration. And we know when we get dehydrated, a lot of times you might have a headache. You might feel lightheaded. Often you get a dry mouth. Your salivary glands dry up. You can be tired, as I mentioned, and have cramps and thirst. We also know that it could cause your heart rate to go up as well. So it can cause some changes in the body. And so when we're looking at dehydration, really there's two things going on. If we lose water, then what happens is we technically have more sodium in our blood. And so losing water or adding salts is going to cause basically high sodium levels. And this was the trigger for ADH. When ADH is released, its job is to decrease our urine output and pull that water into our blood. And you also will feel thirsty. So you should probably try to drink often during the day. They say like every 15, 20 minutes, take a sip of water, because by the time you feel thirsty, you're actually already dehydrated. So what causes us to feel thirsty? If our plasma volume drops by 10%, or we have an increase in plasma osmolarity, so blood volume falls or osmolarity goes up, we get hypertonic, that is going to trigger our hypothalamus, the area that controls thirst. Well, once we become hypertonic, what we said earlier, if we have our blood and our cell, that if our blood were to become hypertonic, that means it has a higher osmotic pressure. And so what happens is water is going to leave the cells. It will be pulled into that hypertonic blood, and it can even leave your interstitial fluid to try to enter the blood. When this happens, it actually pulls water out of your salivary glands. That's why you get a dry mouth. When you get a dry mouth, again, that's a sign that you're dehydrated. This also happens in the cells that are in the hypothalamus. So when water leaves the cells of the hypothalamus, that's what triggers that sensation of I'm thirsty. I need a drink. And then you take a drink and your thirst is quenched almost immediately. The two things that make you feel like, right, your thirst is quenched is when you moisten your mouth, when the water hits your mouth, and then when it hits your stomach. There's some stretch receptors in your stomach. So if you've ever watched like a marathon race, and if you've ever manned the water station, a lot of times when athletes are working at a high intensity, they don't want to drink a lot of water during the event, but they get thirsty. They're getting dehydrated. They need to hydrate after the event. But if you've ever noticed the water station, a lot of runners will grab the water and they'll just put it in their mouth and they'll swish it around and they'll spit it out, and then they'll go to the next water station. Well, that's not helping them with their hydration, but it is making them feel better, because when you moisten your mouth, your mucosa, it helps dampen that sense of thirst. So if you've ever had like a stomach bug, or you're really, really thirsty and you can't drink, just suck on some ice or moisten your mouth and it will help relieve that sensation of being thirsty. And then the last one is called hypotonic hydration. This is water intoxication. You're overly hydrated. This could happen if your kidneys aren't working. This could happen if you drank a lot of water too quickly. It takes about 45 minutes to inhibit ADH. So if you were drinking large volumes of water before ADH could be inhibited, so you would urinate it out, you would have very dilute blood. So this is dilute blood. When you have more water, you have basically less sodium, and this is a severe condition. It can cause hallucinations, convulsions, cerebral edema. And so in this instance, if we look at the blood and we look at the cell, now the blood is hypotonic. It's more dilute. And when the blood is hypotonic, now the cell has the higher osmotic pressure. Water is going to leave the blood and it's going to go into the cell and into the interstitial fluid, which causes a lot of edema. Well, this edema will also happen in your brain. And when it happens in your brain, it can send you into a coma and be fatal. And you may have heard of the case where this happened when the Wii, the Nintendo Wii, first came out. This radio show had this competition to hold your Wii for a week. So they had people come in and they drank water, and whoever could hold their pee the longest and not go would win a Wii. Well, what happened was the woman who won it went home, fell into a coma, and they found her dead the next day because of this hypotonic hydration. She had too much of the water intoxication and went into a coma. So this is kind of a down note to end our lecture on, but this does wrap up our lecture today when we're looking at fluid balance.